Hi, I came to see Dr. Nezami about my condition, fibromyalgia, chronic fatigue. I was diagnosed at UCSF. I've tried quite a few different treatment protocols over the past year and have continued to get worse. I ended up on disability in June, and this is my 6th treatment here at the Pacific Medical Center of Hope, and it certainly has given me hope. I've done the hyperbaric oxygen treatments and IV treatments, and I feel so much better. I can't believe it. I do have hope now, and I didn't have any hope before. My wife had to drive me to my first appointment. I couldn't even drive. I've been mostly tied to the house and oftentimes in bed. And now I have energy. In fact, my wife and I are planning a trip to see our daughter in Sacramento this weekend. I'm so excited to be able to leave the area and see my daughter. She's excited to see us coming. So I just thank God that I was able to find Dr. Nezami, and I'm really excited about my future. I'm excited about returning to work, and a whole new world lies ahead of me, because I was very desperate and looking for someone to help me, and he's been very attentive to my needs. He listens well, and I'm really happy that I came here, and my wife is really happy for me too. My kids, we have kids on the East Coast, and they're so excited because every time they call, I'm usually sick and can't come to the phone, and she has nothing but bad news to report. And lately, they're just shocked. We actually Skyped our daughter this past week, and she goes, "Oh my gosh, your voice, and you sound so much better." And she said, I can see it in your face and tell it in your voice. So we're really excited, and I can't say enough about Dr. Nezami. Thank you.
Thank you so much, Doc, and I appreciate sharing the information with the public. And chronic fatigue syndrome and fibromyalgia is something that most of the conventional doctors really don't have a clue or answer to it, and I always see patients who have gone through a long way of many modalities, experimented on them, and unfortunately they face the closed doors. And would you tell the people a little bit about your past experience as far as the treatments that you have tried, and unfortunately the conventional treatments did not work?
Yeah, I've tried different kind of antibiotic protocols. One called the CAP protocol, where they use 3 different antibiotics to kill certain things. I've used oxytocin. I've used nystatin. I've used infrared therapy. I've used, let's see if I've mentioned everything. I know that there's a long list. I'm having a hard time thinking of all of them. I did try oxygen, just oxygen through the nose. That didn't work. I've had all kinds of, I've been to neurosurgeons, orthopedics. I've had injections in the neck to relieve muscle and neck pain. So I went through a lot of things before I even had the proper diagnosis. And then after getting the proper diagnosis, I went to many doctors that didn't know what to do for me, and told me to do graded exercise. They told me to do cognitive behavior therapy. They put me on all kinds of sleep meds, all kinds of things. And right now I'm only using a little bit of melatonin at night, and my sleep is getting better.
Well, that's great. In such a short period of time, it's probably even not more than a week that I had seen you, and your response in a short period of time as it is very encouraging even to us, and I look forward to continue treating you and have this message both to physicians and the people, patients, to try to address the cause of the problem instead of addressing the symptoms and putting the patient on high doses of narcotics and painkillers. Try to address the patient's problem through the cause of the problem, which in case of the fibromyalgia and chronic fatigue syndrome is the immune system and neuroendocrine system, and that's why we're treating those with all natural therapies, and thankfully none of them has any bad side effects in case, and it does increase the patient's quality of life significantly. Well, thank you so much for sharing the information, and I look forward to see you for many years doing better and better every day.
Thank you.